I'm Zachary Laksman, and I've been supported by Health Research BC. Atrial fibrillation is the most common heart rhythm disorder. Wait lists for surgical procedures are up to and exceeding 12 months in a lot of places in British Columbia. One thing that I wanted to look at early on in my career was, could we identify people that are at risk? We started a biobank here at St. Paul's, and we're able to find a solution or an answer as to why up to 15 to 20% of patients had atrial fibrillation. Now that we know why someone might have atrial fibrillation, we want to know how to treat them in a very personalized way. And so over the last 3 years, for example, we've built our own 3D bioprinter so we can make engineered heart tissue. We want to figure out the best way to manage that person right from the time of their diagnosis or even before that. So we're working through this process of basic science platform development and trying to understand how we can actually translate that into a clinical platform and offer it to more patients in the future. There's no question that Health Research BC has been a lifeline for early career investigators who are looking to put their ideas into practice. And without that type of support, a lot of these ideas would have never taken shape. These are not short-term projects. These are not easy solutions. The projects are never finished, and no one can do it alone. So we're really waiting for that next generation of researchers to hopefully join us and build a bigger and brighter future from the things that we've been able to do with the support of Health Research BC.